Good afternoon, everyone, and you are welcome to a special edition of QPS TalkTime. We are coming to you today from Dublin Castle, from the MPSO conference here, and it is World Patient Safety Day, so it's great to be able to do this today. What we want to do today is really give you some of the highlights of the conference here today for people who can't be here. Today is World Patient Safety Day, and the focus of World Patient Safety this year is on improving diagnosis for patient safety. So get it right and make it safe is this year's slogan. There's also a local theme here at the NPSO conference today of Think Global and Act Local. So we're gonna explore those. Again, if people want to make some comments or ask some questions in the chat, we're going to be meeting some of the people at the conference here today, and we'll try and get back to you. So I think we'll just get started. I think, and I'm going to introduce you to Kate O'Flaherty, who is the director of the MPSO. And Kate, well done on organising another great conference here today. And do you want to tell us about some of the highlights of today's conference, the things that have stood out to you?
Sure, yeah. And as you say, it's fitting that we're here in Dublin Castle for our conference on World Patient Safety Day. And we have organised it in collaboration with the HSE and Patients for Patient Safety Ireland. I think there's probably a number of things to pick out that are special and that we're focusing on today. I suppose firstly, the Minister announced this morning that the Patient Safety Act, the Patient Safety Notifiable Incidents and Open Disclosure Act 2023, that many people will be aware of and indeed maybe have fed into consultations on, that will be commenced in the coming days. So there's a lot of work to do, including with the HSE, a new comprehensive training module for staff around open disclosure. So certainly that's an important marker for the day. As you say, the theme of our conference is Think Global, Act Local. I guess when acting local to get it right and make it safe. This year we're focusing, I suppose, on some of the bigger reforms that are underway under Sláinte Care, particularly on the health regions that we're now moving to. So we've just had a panel discussion which included a number of the REOs and talking about how those new structures and the way that we will change how we do things and move things to a more local context in the regions. What are the opportunities for strengthening patient safety, for strengthening public involvement, for trying to, I suppose, improve on what we're already doing at a national level? That really is kind of an essential component of a safe health system. There'll be the patient app. There's, I suppose, lots of other innovations. So the panel discussion later, which you will be on, John, double jobbing no more than myself today, we'll really look at from the patient and the public perspective about how do we, again, harness the opportunities from digital health for patient safety. What do we need to put in place around health literacy, digital health, empowering patients as part of that. And then I suppose the last thing that we are using the opportunity, I don't know if we're one of the first countries in the world to, but the new WHO Patient Safety Rights Charter, which was published earlier this year. So we're highlighting that, and we'll be kind of signing up and committing and getting people to kind of use it to refocus their commitment over the next year to patient safety. So many of the rights, maybe nothing particularly new in it, it's just a new expression of all the principles and things that we commit to in our work to improve quality and patient safety.
Yeah, fantastic. It's been a great day so far, and great to see so many people on the diversity of the panel today, and good representation again from Patients for Patient Safety Ireland and yes, and the REOs and all of the leaders within the service. Kate, thank you so much. I look forward now to the afternoon, and I'm going to hand over to Juanita, who's going to introduce two more people that we've met today at the MPSO conference.
Thank you very much, John. And I'm delighted here to introduce Bernie O'Reilly, who's the chair of Patients for Patient Safety Ireland and would be a familiar face to many of you, and Joe Ryan, who's our national director in, I need to look at this now, sorry, but public involvement, culture and risk management. Did I get that right? Great stuff. So both of them are co-chairs of the working group that have been looking at the resources for World Patient Safety Day. And we're just going to share one or two quick slides with you just so that you can see some of the resources that are available. They're all accessible at the moment on the HSE website under National Quality and Patient Safety Directorate. So you'll find them there. And with these resources, I suppose they're accessible. There's a broad range available for staff and the public, and they're a mix of new resources, but also collating existing resources, because there's a lot of existing resources within the system that are applicable when we're thinking about diagnostic safety. And the theme this year that we're looking at is listen, diagnose, understand, working together for patient safety. And that working together is probably one of the most fundamental parts when we're thinking about communication. A lot of the diagnostic safety work, when we looked at the evidence around it, and it's all accessible on the website, as we mentioned, but communication, teamwork, training and self-awareness come up time and time again. And we'll just show some of the resources that support those themes that are available on the website. So this is the QR code where you'll find access to the website, and on that page there is a memo that's available that has all of those resources on it, and they're listed on that. And as I said, they're there available for the public and for staff. So there's information on trusted sources of information, improving communication and understanding diagnosis. And it's the continual improvement around diagnosis that we're looking at, because there's a lot of people with significant knowledge within the system around diagnosis already. And the last piece there is improving systemic factors. One of the key resources is the My Health, My Voice leaflet. And we're going to just ask Bernie, who's used the leaflet, maybe just to tell us a little bit about her experience and whether she thinks it will be helpful for diagnostic safety. Thanks, Bernie.
Well, I think any aid that assists you, we know our GPs are time poor, so anything that assists us in our engagement with our GP. So a helpful aid is this leaflet, My Health, My Voice, and it actually focuses your attention on what you want to get out of this GP appointment or healthcare appointment, and it allows you to think about it in advance, list the things that are most important to you, and then it also helps you to log the information you're given by your healthcare practitioner, and it gives you opportunities to actually, I suppose, question the advice you're given so that you understand it, and give you confidence to actually raise questions. So it's kind of got it's multifaceted really. You can use it whatever way you find aids your appointment, and we're encouraging people to use the aids. For some people, bringing a person with them to their appointment is helpful. You know, other people can already, articulate themselves in a very concise manner, but sometimes when you're not well, even the most articulate people lose their train of thought, or mightn't just totally come away from their GP with an understanding of what they've been, advised to do. And their next steps, it's important to know your direction of travel, and why you're going in this direction of travel. So to be aware of to get the most out of your appointment. It's not to shorten your appointment. Some people need to have longer conversations, and some people can go in, and get a lot out of their appointment by being focused. And I know at one of my appointments, I did try the leaflet last year when in one of the earlier iterations, and I did find it focused me, and it gave me I wanted to get 4 things achieved in that one appointment. And quite often you'd be told, we can only handle 1 or 2 things. So I was determined. I was paying my money and I was getting bang for my buck, and I was going to try a new approach. So I listed the 4 things I wanted done. Some of them were referral appointments. Some of them were just like getting my blood pressure checked and my tablets renewed. One of them was I had a sore wrist, which did warrant an X-ray, and I wanted to get my DEXA scan under control. So I went in with my bucket list, and the GP was very impressed. I mean, literally within about 7 minutes, he'd said, yes, referral, tick, tick, tick. And he'd done the whole lot. And he said, what's this? This is new. And I said, yeah, you can have a couple of complimentary copies here to try out with other people, because this is the trial run. And, but like any aid, for some people, it's just writing those questions on a piece of notepaper. The fact that these are hopefully going to be available in our GP services, surgeries and in our healthcare facilities around the country, it makes them accessible to people. And that's it. They have to be out there being used. I mean, we had previously worked with Keep Your Medicines list. It's only helpful if people can access it. Having them stored as doorstops in your practice is not good practice. So make them available to people, and they do stimulate conversation. And there's loads of helpful things. There's links on the back which bring you to the A to Z of health conditions, which is, they're reliable sources of your information. Right, don't use Dr. Google, but we all do. But if you go to the right if you go to trusted sources, well, then it's an aid. You know, you don't want to be getting misleading information. Again, the QR code to the medicines list is there, a connection to patient safety and the patient forum and all the places where patient engagement are happening, you know, as we know them. Hopefully there'll be new innovative ways of connecting with patients as the health regions are rolled out. And I believe that the 5.5 million people in Ireland all need to be advocates of their own healthcare whenever they're on a patient journey. So I'm a big believer in empowering everybody, not just the spokespeople who get plenty of opportunities. I get loads of opportunities to engage, but I think everybody needs to be proactive in their own personal healthcare journey.
That's it. And you touched on something really important there, and it's having the leaflet accessible to people. Interestingly, one of the pieces of feedback that we found when we spoke to a woman who trialled the leaflet first, so this leaflet was tested with a consumer panel and then it was tested within acute services and within community services. And what she said to us at the time was, I had the form filled in, but my doctor didn't ask me for it. So it's really important that even if the leaflets are accessible, that we still might prompt somebody to have that conversation and say, gosh, I see you've filled in the leaflet. Or, you know, that equally as a healthcare professional, you might like to structure a conversation. And it's very important to know that we don't expect everybody to fill them in. But for a lot of people, there's 1 in 3 people in Ireland will struggle with health literacy, as we know. And it's trying to make it accessible, because that communication is the first step in a lot of that diagnostic safety that we're going to talk about. And we'll be talking to John in a few moments a little bit more about diagnostic excellence. You touched on the direction of travel and, you know, the patient's role in choosing what that direction of travel is, I think, a little bit. And maybe I'll come over to yourself, Joe, to talk a little bit about this. You know, in your role, how do you think we can continue to improve patient partnership in the diagnostic process? You know, why do you think that work is important?
I think the work is important. You know, we put the tools and we put increasingly more tools in the hands of our patients. And Bernie's right, we have to get them out there. They can't be holding doors open or gathering dust, you know, because they are so useful. But when we put those tools in people's hands, then it's really important that, you know, as a system, we know that our patients and our service users are going to use those tools, and that our culture is one that it welcomes and embraces that. And you know, all morning, every single contributor, without exception, this morning, I think said culture underpins all of this. And what does culture mean? Culture just means our attitudes and our behaviors. And so, are we welcoming? Are we embracing these tools and the participation of our patients? And I think that's just, you know, possibly the most important, I suppose, key to success of these programs, and of, you know, having the tools like My Health, My Voice, that the person feels confident in doing it. In fact, is encouraged to do it. So if they walk in and someone says, "What's that you have? I don't know, we didn't hear about that," then we haven't got our part right, you know, in the health services. So I really think that presence for our patients and our service users in designing and co-designing our services is crucial, because, and then it behoves all of us who work in the service to actually engage, to make ourselves aware of what is happening in this. That co-design can't just be a select few. Everybody has to be able to at least know what's going on and contribute to it where they feel they can and should contribute to it. And I think if we get that shift where we welcome and embrace our patient and service user involvement, then we'll have taken a massive step forward. And these tools then will just become, you know, almost exponentially more powerful, because, you know, there's nothing worse than someone saying, "Well, I've had this list," and then the person goes, "What list? Forget about list." You know, I really think there's a huge opportunity for us there. And when you get the response like, "That's great," and you have all of your 4, and probably ended up being 5 or 6 things that were sorted, you feel better. You feel that you've been listened to. You feel that, you know, that action has been taken. So that's when you know you've been heard. And I think that makes the job easier. You hit the nail on the head, Bernie, with we're time poor, not only in our GP services, but right across our services. So if the patient can play a role in making that engagement, you know, more efficient and effective, then, you know, that's a huge step forward for us.
That's it, yeah. No, so thank you both very much. I'm conscious that they're both going to be on panels this afternoon, so we don't want to delay them overly, but thank you both for joining us. I just see that there's a question after coming in from a colleague, Bernadette, and she'd asked about patients that might not have the required digital skills. It's probably helpful to note that the leaflet is available in an animated video format, and also it's got a voiceover with it that explains all of the information. And one of the things that we've done is on the website, it's available in share file, so services can actually download it. And if you have a television screen in your waiting room, if you have, a link in a letter that you're sending out to people, potentially any way that you can think of to share that message so that they can look at it. But very often, a lot of the time, we're sitting in waiting rooms and we're looking at a blank television, or we're looking at something that isn't health related. It's a wonderful opportunity to maybe share these types of resources with people in those settings. So we'll go back over to John now, and we might just pause for a moment. So as we're doing this, we're going to say goodbye to Bernie and to Joe, and thank you so much again for your time. We really appreciate it.
Thanks.
We're going to do a little bit of furniture removing here, and John is going to join me over here, and we're going to pop up a new slide. And the new slide is just one of the frameworks for diagnosis and diagnostic excellence. And we're just going to have a little conversation around that. As I said, there's a whole host of resources available on the website. And in particular, our colleague Gavin White in the library did a literature review for us and looked up the latest information in terms of papers that are around research and available to access free. So they're available on the website on the World Patient Safety Day site. So we'll say hello, John, again. This time you're in the hot seat this time, but we're going to pop up the slide. So this is the model of the diagnostic process. And John, I might start off with yourself. Why is diagnosis important from a patient safety perspective?
Yeah, so it's been long recognized within patient safety that there are certain things that we do in healthcare that carry a higher risk than other elements of healthcare. And one of those components is the actual act of diagnosis. And of course, diagnosis is central to healthcare. And for many people, it's their first contact with the healthcare system is that they come with a problem that requires a diagnosis. And so getting a timely and accurate diagnosis and then communicating that well is very, very important. And as everybody knows, diagnosis can sometimes be very simple. Sometimes, people make diagnoses every day. Parents diagnose, their children with coughs and colds and common problems. But we also know that diagnosis can be really, really complex. And because it's complex, things can go wrong. And so I think one of the ways, and again, it's a very kind of human factors approach, is to really understand what diagnosis is and break it down. And this model that comes from the National Academies of Medicine in the US, it's part of the Quality Chasm series. And people may be aware of the first of those reports called Crossing the Quality Chasm. That gave us the things we talk about, that care should be person-centered, safe, effective, timely, equitable, and efficient. And so this is part of that series. And what it does is it recognizes three kind of major components of diagnosis. One is this diagnostic process, which is how a diagnosis is made. The second is the work system that the diagnostic process happens within. So that's the GP surgery or a hospital clinic or in the community. And then finally, what are the outcomes of that? And of course, the desired outcome, like I said, is a safe, is a timely and accurate diagnosis. That's what makes it safe, but also that it's communicated in a person-centered way. And I think when we look at this, then we can start to see, what are the things that I suppose go right and that we should be doing more of, but also where things can go wrong. And we use this really for the basis of our podcast. So we've made some podcasts to mark World Patient Safety Day. And we speak with Dr. John Brennan on what it's like to make a diagnosis every day and how that happens in general practice, how it happens in the work system, and what it's like to communicate that. We talk also to Professor Eva Doherty, who runs the Human Factors program in the Royal College of Surgeons. And Eva talks about the cognitive challenges of making diagnoses. So we want people to think when they're making diagnoses, but there's lots of problems in thinking that we need to be aware of. So what we call cognitive biases, or places that we can trip up. So being aware of those can really help, and there's lots of things that we can do collectively to try and help that. And then how do we, when we have that diagnosis, how do we communicate it?
Okay.
And then diagnosis is also dependent on investigations, and there's lots of things, so we're familiar with things like radiology. And again, all of these are dependent on people, so things can go wrong. So again, understanding, where the common errors and where the things that we can maybe improve on, especially getting data and learning about the problems that we have. If we know about problems, then we can do something about them.
Yeah, thanks very much for that, John. One of the things that Eva had talked about in the podcast was resources available to check to see what your biases actually are. And I tested them myself, and it's actually, it's not so much, am I biased? It's more, what are my biases? Because I think everybody, by virtue of
Part of being human.
It's
I
part
think,
of being human.
we say in the podcast, there's no shame in recognizing your biases. Now, I think we can work to try and at least be aware of those biases, and even there are things you can do to take them away. But that project implicit, you can go on and see that all of us, I think, carry these biases. But there, again, there are things that we can do to compensate for them.
That's it. Brilliant. And there are some excellent, I suppose, tips within each of those individual podcasts. There's also a podcast that's there with Matthew Reid and his wife, Shima, talking about Matthew's journey of diagnosis, and some tips from the GP, Dr. John Brennan, talking about what can you do as a person accessing healthcare services. So what I would say to you is, this can be one that you might like to promote to people coming into your services. It might be one for your family and friends, or for yourself with your patient and service user hat on, because all of us access the services. The other piece, I suppose, just a signpost from a communications perspective, is the National Healthcare Communications Programme. And John, Winnie has done a huge amount of work on this. Do you want to tell us a little bit about that programme?
So, again, I think communication is core to everything within patient safety and just being able to operate in a complex healthcare system. And National Communication Programme has some really wonderful examples, highly evidence-based examples of where communication skills can be used. And again, these are skills that any of us can learn, even if we believe we're good communicators, that we can enhance our communication through that. And I think there's something you can put into practice, and there's an app, and there's lots of ways of accessing those resources. Yeah,
that's brilliant. Thank you very much for that. So we're going to now move over to three of our colleagues that are working within the healthcare services. And I'll hand over to John, who's going to have a chat with each of them, and we'll introduce them.
I'm going to move back over
just,
there.
Just while that's happening, I'll just sort of finish up by saying that all of the resources, as we said, they're available online. The other thing we would say to people is, as you're looking at the resources and as you're promoting World Patient Safety Day, if you're doing things within your service at the moment that you'd like to share with us in our next newsletter edition or over the coming days, if you're putting things up on Twitter or LinkedIn, tag us in at National QPS so we can share it. Because one of the things that we found is that it's really beneficial for people to be able to see what's happening within different services. And without further ado, I'm going to pass over to our colleagues, and just to say thank you very much. We'll talk to you soon.
Thanks, Juanita. Now we're back in Studio 2, and it's good to be here. And I'm pleasure to be joined today by Anne-Marie O'Neill from Thrombosis Ireland, with Mairead Holland. You're also from Thrombosis Ireland, Mairead, or you're a patient service user. Where are you based?
I'm based in Dublin and Midlands region.
Dublin Midlands region, you're very welcome. And Maura Grogan, and Maura, you're from Tipperary University. Great. It's World Patient Safety Day today, and really what I wanted to know is what are you doing to mark World Patient Safety Day, and how do you use the event when it comes around? Anne-Marie?
Yes, well, I suppose Thrombosis Ireland tries to empower all of our blood clot patients to have a voice, to stand up, be counted. So this year for World Patient Safety Day, we put together a clip for social media which involved a number of different patients highlighting the symptoms of blood clots and encouraged them to ask their doctor, could it be a blood clot? But we also linked it with the My Health, My Voice leaflet. If they do get that diagnosis, that they had to say, what do I need to know now? What do I need to do next? And what can I expect now? So that's really how we linked it. But really, World Patient Safety Day for us is every day.
Yeah, absolutely. And I mean, do you think things like, this is a simple tool, My Health, My Voice, 3 questions, do you think that can make a difference?
I think it is if the patients are given it. I don't think they're necessarily going to pick it up. There's a lot of leaflets in every surgery.
Yeah.
I think probably better coming from the consultant or doctor that they're meeting
Yeah.
at the table to say, why don't you take this before we start, and give them a pen and say, if you have anything, any questions, or here's some questions to prompt you, and you can take some notes.
Yeah,
But I do
totally
think they
promote
need a
it.
little prompt and promote it that way. And then people will get used to it, and they might go looking for their leaflet
Yeah.
then. But I think initially we need to get the backup of the guys at the top and the
Yeah.
girls at the top.
Yeah, yeah, fantastic. So yeah, we've all have a task in getting this out there and making people aware of it. And I like when you said there are some good tools supporting kind of the education and video as well around this. Mairead, what are you doing to mark World Patient Safety Day?
Hi John, I work in the community in Dublin, South Kildare, West Wicklow. So we started yesterday. We were out in the primary care centre, the Russell Course Centre in Tala, which also has a chronic disease hub related to it. So we met with a variety of patients there. There was a lot of clinics going on. We met with antenatal patients, wound management patients, people attending diabetic services. And then we met staff like from the admin people, the consultant cardiologist, lots of health and social care professionals around yesterday, and nurses from the respiratory hub. So we chatted with them, we showed them all the resources from the VTE resources, My Medicines list, which is always popular with patients, My Health, My Voice, and then the sepsis information. And there were some mothers present, so they were really interested in the sepsis information for children. So that's how we started. Now, as the month goes on, we've health literacy courses starting with community groups in Clondalkin and Newbridge and Tala. So it's going to be part of that programme. It's going to be in their resource pack. And really, that whole programme is about empowering the patient to be able to go in and have the conversation with their doctor or healthcare provider. And then this month, we're also going out to the Kildare Age Friendly Roadshow, and we'll have a stand there, and I'm sure we'll have a lot of interest in the resources at that stand.
Yeah, it's fantastic. And like Marie said, you know, today is World Patient Safety Day, but every day is Patient Safety Day.
Absolutely.
And I mean, how do we get patients to participate more in diagnosis?
Well, I think we just have to really have that conversation with the patient. Now, our role is about involving the patient in decision making. So as patient service user engagement, when we do our training, we include it in training, we include it in awareness days, we include it in the quality safety service improvement services, and we partner with agencies like the Patients for Patient Safety Ireland. So it's a matter, as Anne-Marie says, it's a matter of every day spreading that message and having the resources out there. And the resources, it's really the message and the culture which they spoke about at the conference this morning, where we're working in partnership with people and they're not afraid to ask questions, and if they don't remember, that they're empowered to be able to ask, and that no question is a stupid question.
Yeah, it's about normalizing that involvement, isn't it?
I know people aren't inclined to ask, they're afraid. They put the doctors up here and they think that maybe they're wrong. You know, we've had a lot of patients who maybe initially are misdiagnosed, and it's only their instinct screaming at them that they return. And if they hadn't returned, they'd probably be dead now. So really, it's about encouraging people not to be afraid. If you feel there's something wrong, you need to push it. You've got to have a voice because they're overworked. The doctors and nurses are overworked, really. And they need to, you need to be a little bit louder, I think, for people to hear you through the...
Yeah, we talk a lot about this concept of psychological safety, being able to speak up, and that nobody's going to get upset with you if you speak up, and even if you're not right, but that it's safe to do that.
Well, there's no need to be rude, but you can actually put your point across and say, look, I am really not well, or there's something wrong here. I wouldn't normally feel like this, or it's paying more than I would ever be used to. To be able to feel like you can speak out, I think, how do we do that?
Super, thanks. Maura, you're from Tipperary University Hospital. What are you doing to celebrate World Patient Safety there?
We're actually focusing will be on Thursday, to be honest with you. We're going to raise awareness for it's sort of an integrated approach that we're working with at the minute. We've kind of an MDT team of specialists in posts. We're bringing all the hands on deck really to get this over the line. As we're actually starting with the basis of positive patient identification. Because we're finding that sometimes that's where there's a discrepancy. Sort of, are you such and such? You said, what is your name? What is your date of birth? Because it's amazing, which actually goes back to your point about being, say if you're in a clinic and the patients come in and they which I suppose where this leaflet is going to come into it, that they're in such a short period of time, maybe in the clinic, they're nervous going in. They're worried about their health, the side effects on it, maybe social conditions, psychological conditions for them at home, and how they'll adapt to that. So therefore, when they walk in the door, they're so nervous, they nearly don't remember their own name. So they will actually ask you, are you so-and-so? And they'll actually nearly say yes. So we're actually, what is your name? What is your date of birth? And build from that. We're also doing a little piece in terms of improving diagnostic accuracy. We say, you know, the paused checked approach, we say, that we have for our radiology colleagues. So that would be, we say, the pause with the patient, have you got the correct patient, the anatomy of the correct part of the anatomy, the user checks, you know, the appropriate implants or pregnancy from that point of view, systems and settings, the end, and then again, the draw to a close, like have you, is there follow-up for that, repeat tests or what needs to be done. We're also focusing again on from the whole medication side of things. So there's stuff that has come up with our patient safety strategy, so the key causes of harm. So we've taken a key piece from that, and one would be the medications. Like your second room, so we have my medicines list that we're giving to our patients, and we're finding now that it's not just our patients we're giving to it, our staff are bringing it home for their relatives and friends. Because I suppose when you're in Tipperary University Hospital, it's our very great privilege to be in a position to care for the people that are going to present back into us, and that's our colleagues, people that we work with, their families, their friends, their relatives. So we need to look after everybody, because we could be the next person walking in the door. So it is our great privilege to do that. So we have to be sure that that's okay. So we find our staff are taking these home for them to be filled in by mum or dad or whatever. Also another key piece we find is the salads, the sound like lookalike drugs, and the applications, should say, the ones that seem to be causing the most bother. So just again, it's raising awareness on the day for these things for both our staff and our patients. The other pieces that we're taking, which very much links into with the VT awareness. I mean, it's a huge risk, a risk of clotting. Hospital patients come in, their mobility is reduced, especially when we have outbreaks in wards, then you're trying to contain the patients really, and the family. So, I mean, VT is just a huge area that there needs to be knowledge and awareness for out there. We're watching a lot with pressure ulcers, so our tissue viability colleagues will be in help us with that, and again their awareness of falls, because again if the mobility reduces, in comes the fall. So we're doing a lot of key areas that we're pushing awareness for them, healthcare associated infections. And a little piece we've introduced this year, I suppose, which was brought in by our Patient Service Representative Users Forum, because we were looking in TIPUH, we have 25 years of our Patient Service Representative User Forum. So we're bringing a piece on dementia and disabilities. So we have, would say, additional information on providing easy read leaflets, communication with eating and drinking for patients with dementia. So again, it's just with the 480 assessments going on that we're training our staff on, both in ED and on the wards, to be sure that that's, you know, awareness from them. We're lucky that we have our regional literacy coordinator, so she helps us and supports us for these events. So I suppose it's, what would I say? It's a full team approach.
Listen to you all. There are so many things, and it's not one thing, is it? I mean, and everybody, you know, can contribute, obviously, in particular patients and families, but there's so many little things, and I think that's probably where safety comes from, isn't it? When you get all the little things, when you start to get the little things right, they build up into keeping people safe. And how do we keep people involved and interested in this? Because there are so many things to keep doing.
Well, I suppose you have to find the little nugget that triggers presses their buttons, don't you? And that triggers them to get involved. And that goes for both staff and patients. So if you find that one thing, but we have it now coming back from reviews, learnings from reviews. So I suppose, as you mentioned earlier on with the National Healthcare Communication Programme, so that was a piece that we ended up introducing with staff. So then they see the tricks of the trade, basically, that if you mean, nobody's saying that you can't communicate, everyone can communicate. It's just how can you actually just make the most information available or take in the most information in the smallest amount of time. It's like the changing of tires in the Grand Prix, isn't it? You know what I mean? Like Ford used to take them 6 seconds, now they're down to 3.2.
I think it's about making it inclusive. It can happen to any, like patient safety involves everybody, every one of us, from both sides, from the healthcare professional side and the patient side. So it's if people realise that it's in everybody's interest to ensure this happens. That it's a safe environment, then we're all invested in it.
Yeah. Like it keeps patients out of hospital. That's the bottom line. Patient safety keeps patients out of hospital. It shorter length of stay. You know, that's the key, really, isn't it? It keeps you out in your own environment at home. So the safer we can give care to our patients, then the less admissions there be, the less issues
Yeah.
we're going to have with
It's
know,
integral to everything, and I think there's lots of overlap. Yeah. Well, look,
There's lots of different ways to spread the message as well, because now we've podcasts, you know, we
Yeah.
have lots of automated ways of, it's not just maybe the newsletter, there's Twitter, or if you look at Twitter today and there's all this conference detail and everything. So it's a multimodal approach, I think, as well, to really get to all users.
yeah, so lots of ways to pick up the information and lots of ways to get involved and to stay involved. So thank you all very much. I hope you enjoy the afternoon and get to enjoy the rest of the conference.
Thank you very much.
So just want to thank everybody who came to join us this afternoon, and to thank Juanita and Chris, who've been pulling all this together behind the scenes. There is a supplement that's been produced by the Patient Safety Together team, and I think that's going to be up on the Patient Safety Together website as well later today on diagnostic safety. So I encourage people to check that out. And our 4 podcasts, and like we said earlier, we're very grateful to Matthew Reid, who told his story as part of the podcast, and also to Professor Eva Doherty and Dr. John Brennan, who joined me for those podcasts. We also had the chance to speak with Hardeep Singh, who is an internationally renowned patient safety expert from Houston in Texas. And he's done most of his work in the area of diagnostic safety. So we get to chat with Hardeep for about 15 or 20 minutes, and I'd certainly recommend checking that out. We hope to have Hardeep Singh on maybe early in 2025 to talk to us on QPS TalkTime. I'm going to sign off, I think, at this stage, and we're going to get back to the conference for the afternoon. So thank you for joining us.